Welcome to This Explainer. Look, if you've been down this road before, giving birth after a C-section can feel, honestly, like a maze of medical jargon, right? But today, we're going to distill the source data to bring some real clarity to your decision-making process. We're breaking down the facts so you can figure out the absolute best path forward for you and your baby. Let's just jump right in. Okay, let's anchor our journey with this incredibly reassuring medical fact. Whatever path you decide to take, whether that's a vaginal birth or a repeat cesarean, you're making a safe choice. As the medical guidance literally states right here, both carry only very small risks. So, take a deep breath. You're in a fantastic starting position, and the goal now is simply to find the option that fits your unique life best. So here's our roadmap for today's explainer. We'll be looking at Section 1, navigating your birth choices, Section 2, exploring the VBAC option, Section 3, planned repeat cesarean delivery, Section 4, when birth plans change, and finally, Section 5, managing umbilical cord prolapse. Let's go. All right, kicking things off with Section 1, navigating your birth choices and understanding your medical baseline. To help you choose, your medical team is going to want to establish a baseline by looking really closely at your unique history. And the sources emphasize this isn't just about staring at charts. They need the whole story to build a true partnership with you. So they're going to review things like the exact reason for your previous C-section, like was it a scheduled thing or a sudden emergency. They also need to know the specific type of cut made in your uterus, because that dictates its structural entirety. And, just as importantly, they want to discuss your feelings and concerns about that past birth, plus the overall health of your current pregnancy. It's all about tailoring a plan that safely balances the clinical realities with what you actually want. The source material basically puts us at a crossroads here. On one side, we've got the vaginal birth after cesarean, or VBAC. This means aiming to deliver vaginally, which, hey, might sometimes include a little assisted delivery, using forceps or ventouse if things need a nudge. On the other side, the elective repeat cesarean. This is a planned surgery, usually put on the calendar about 7 days before your due date. These are your two main options. Both are beautifully valid, but they are fundamentally different in their clinical approach, their recovery times, and honestly, what they demand from your body. Moving right along to Section 2, exploring the VBAC option, where we'll look at the benefits and statistics. A successful VBAC comes with some fantastic physical benefits that essentially create this positive snowball effect for your recovery. First off, you're entirely avoiding major abdominal surgery, and that naturally leads to a much shorter recovery time and a quicker exit from the hospital. Plus, you'll be dealing with way less abdominal pain after the birth. But honestly, the most compelling thing from the data is the long-term payoff. A successful VBAC gives you a much greater chance of having straightforward, normal births in any future pregnancies. It really paves the way for the future. So what are the actual odds here? Well, the numbers are incredibly encouraging. About 3 out of 4 women, that's 75%, who have a straightforward pregnancy and go into labor will successfully deliver vaginally after a previous C-section. Now, that remaining 25%, those are cases where an emergency C-section becomes necessary, usually because labor just stalls out or there's a concern for the baby. But it's actually really helpful to view that 25% not as a failure, but as a proactive safety net built right into the process. The main takeaway, the odds are heavily in your favor. Okay, we absolutely have to address the elephant in the room, the fear of uterine scar rupture. It's a super common, totally understandable fear when you've had a previous incision. But listen to this. The data tells a wildly reassuring story. A scar rupture happens in only 2 to 8 out of 1,000 cases. That is roughly 0.5%. I mean, it is exceptionally rare. And the whole reason you're monitored so closely during a VBAC is precisely because of that tiny 0.5% chance. If there are any warning signs at all, your team is highly trained to instantly pivot and deliver your baby safely via an emergency C-section. That being said, the sources make it super clear that a VBAC just isn't the right choice for everybody. There are a few very specific medical scenarios where your doctor will firmly advise against it, strictly for your safety. For instance, it's generally a no-go if you've had 2 or more previous C-sections, since that increases the risk to the uterine wall. It's definitely not recommended if your uterus is actually ruptured during a past labor, or if you have a high classical vertical uterine incision instead of the standard low horizontal one. And of course, if you have other pregnancy complications that just flat out require surgery, the VBAC route is off the table. And that brings us to Section 3, planned repeat cesarean delivery. Let's look at the surgical route. The sources really highlight a classic medical trade-off when we look at this surgical route. On the front end, you gain immense peace of mind. With a planned repeat C-section, there is virtually zero risk of a scar rupture. You totally bypass the unpredictable roller coaster of labor, and you get a highly predictable delivery date, which, let's face it, makes planning your life a whole lot easier. But on the flip side, you're looking at a longer, potentially harder operation because the surgeon has to carefully work around the scar tissue from your last birth. There's also a slightly higher risk of blood clots or damage to nearby organs like the bladder. And ultimately, you are committing to a longer, more demanding physical recovery. Now let's jump into Section 4, When Birth Plans Change, and adapting to the unexpected timeline. Because as we all know, babies rarely check our calendars. So we need to know exactly what happens if our beautifully structured birth plan takes a sudden detour. The great thing about modern obstetrics is there's always a plan B, C, and D. If you're planning a VBAC but labor just hasn't started by 40 weeks, your team will systematically walk you through these 3 options. Step 1, you can simply keep waiting for spontaneous labor while keeping a close eye on the baby. Step 2, induction of labor. Now, the sources note this depends heavily on your body's readiness and has to be decided on a super individual basis to keep things safe. And step 3, pivoting entirely to a repeat elective C-section. On the flip side, what if you're planning that highly predictable C-section but you go into labor early? Interestingly enough, the data shows this happens in about 1 in 10 or 10% of cases. If this happens to you, the medical protocol is crystal clear. First, do not eat anything. Fasting is absolutely crucial. You need to call the emergency number and head to the maternity unit right away. You'll very likely have an emergency C-section as soon as you arrive. Honestly, the only real exception here is if your labor is extremely advanced by the time you get to the hospital, in which case going ahead with a VBAC might actually become the safer, better option in that exact moment. All right, on to Section 5, Managing Umbilical Cord Prolapse, looking at the Acute Emergency Protocol. While having a plan is great, the source material also gives us this fascinating look behind the scenes at how medical teams prep for rare acute emergencies. Knowing how these safety nets work is a huge part of feeling confident, right? Now, an umbilical cord prolapse happens when the cord drops through the open cervix ahead of the baby, which can compress it and cut off oxygen. The data here is wild. In the general population, this is super rare, just 0.1 to 0.6%. It bumps up slightly to 1% if the baby is breech. But look at this. When certain obstetric interventions happen, specifically when the baby isn't fully engaged in the pelvis yet, that risk can skyrocket to up to 50% for those specific instances. That is exactly why doctors are incredibly cautious about intervening when the baby's head is still high up. When you look at the clinical pathway for this, prevention and rapid identification are literally everything. The very first critical clue of a prolapse is often a sudden, abnormal fetal heart rate right after the waters break. Because the stakes are so high here, medical guidelines firmly state that artificially breaking the waters should actually be completely avoided if the baby is still mobile and high up in the birth canal. It's a strict preventative strategy that honestly just requires a lot of patience. Now, if a prolapse is suspected, the medical choreography is just phenomenal. The team instantly shifts into this fast-paced, highly structured protocol. Step 1, immediate identification using a vaginal exam. Once they confirm it, Step 2 kicks in, which is mechanically elevating the fetus to take the pressure off that vital cord. The doctor might manually hold the baby up or even quickly fill the mother's bladder with fluid to push the baby upward. Step 3 is optimizing the mother's position, usually getting her into a knee-chest position to let gravity do some of the work. And Step 4, the team executes a strict 30-minute delivery target, aiming for a rapid Category 1 C-section to get the baby out safely. It is incredibly fast, deeply precise, and designed literally to save lives. Understanding the incredible safety of your choices and the rigorous precision of these emergency protocols really changes everything. It strips away the mystery, doesn't it? The risks are known, the statistics are exceptionally clear, and these clinical safety nets are tightly woven to protect both you and your baby. So, equipped with all this data, how will you use these facts to advocate for yourself in the delivery room? Thank you so much for joining me on this explainer, and here is to an incredibly safe and truly empowering experience.